Everyone, once again welcome to my Oet channel. Today I came with one role play. So this is it is look like reason role play. That's why I took this card. We can see the setting is health center. It's community health center, and you are talking to a 72 years old patient who visits the health center where you are a nurse. His or her fingernails have become yellow and brittle. You suggest a possible course and give advice on self-care. So this is nothing but brittle and yellow nail, or there will be some infections or any other things associated with that. So in this scenario, what are the possible questions and what are the answers we can see. So the task is in health center. So you don't know regarding the patient, and actually here it starts with collect relevant details. That means they didn't give that you have started already the examination. So it is just like a unknown scenario. So we can start like this. Good morning. My name is Rashmi Rajan, one of the registered nurses working in this community health center. How may I address you and how can I help you today? Then the patient's answer will be, good morning, sister. My name is Johnson, and actually I came here to have some medical attention regarding my fingernails. It became very yellow, and you can see that it is brittle also. Then our task will be starting like this. The first task is collect relevant details, that is a previous occurrence, injury to nail, pain, treatment, tried, etc. So they have given many things, 1, 2, 3, 4. So 4 things we have to ask together means, of course, the patient will get confusion to what is the thing they have to answer. So you can ask 2 questions together always. How we can ask? Well, Mr. Johnson, I'm really sorry to know about your condition, but no need to worry. I am here to help you. Before proceeding further, may I ask you some questions regarding your condition? Then, after getting the permission, you can ask, would you mind telling me some details about if is there any previous occurrence of the same condition? And is there any injury to your nails happened recently? Then they will give you the answer. Actually, sister, it is the first time for me and I didn't have any injury to my nails. Then we can ask, Mr. Johnson, what about the pain? Do you have any pain over the area? And have you tried any treatment at home? Then patient will tell you that there is no pain actually, and I didn't treat anything. I didn't have a try for that. Then the next task is find out further information about the patient, that is a general health and new long-term medication or any other symptoms. We can ask that. Mr. Johnson, thank you for information. And one more thing I would like to ask you: what about your general health? Do you have any long-term disease conditions, or are you on any medications, or do you suffer with any symptoms? This is generally everything it is saying. So we can ask in one question. The patient's answer will be, no, sister, my general health is good. I'm not on any medications. Then we can give the like comment like this: I am happy to know about your general health, which is good. And from your conversation, the next task is we are giving possible causes of yellow brittle nail like aging, poor diet or fluid intake, vitamin deficiency, underlying thyroid problem. We can present like this. From your conversation and from my observation, I can tell you that there are some possible causes for this yellow brittle nail, such as aging, poor diet or fluid intake, as well as vitamin deficiency or underlying thyroid problem. The next task is explain the relevance of these to the patient. So this task can be seen in many question paper. So how we have to ask the question, Mr. Johnson, could you please tell me, is there any relevant to your condition about these factors? Or you can ask that any of these factors are relevant to your condition. So like that we can ask. Then patient may inform you, oh, of course, because of aging, and regarding my diet also, because I am not interested to take food exactly because I have low appetite. So maybe because of that, then we can tell that. Yes, of course, Mr. Johnson, I can tell you that it is maybe because of aging, right? And from your information, I can tell you that there will be, of course, from the diet problem also. Then the next thing is convey that the diet or fluid intake is likely to cause the nail problems. Just need to make dietary changes like increase in fluid intake, balanced diet. So we can give the advice. Always before giving advice, take care. You should avoid, you have to, you should, these things and all you have to avoid, because these all are demanding words. How we can tell? So I can tell you some suggestions. to prevent your condition or to manage your condition. I can stress the importance of fluid and food intake, as well as this balanced diet, because as you told that your fluid intake is very less and you are not interested to take balanced diet, so it is advisable for you to have some diet changes. Please include some vitamins, some minerals, calcium, and everything. If it is balanced, of course your problem can be resolved very soon. How does that sound? Like that we can ask. Then the next task is provide suggestions for improving the condition of nails, regular use of nail cream, keeping nails short. So we can tell that. In addition, Mr. Johnson, I would like to give you some more suggestions to improve your condition of your nail. Like please apply nail creams regularly. Moreover, keep your nails short, cut short. So are you getting my point? Like that we can ask. The last question is recommended making doctor appointment. Health check, rule out any underlying problem, goes like that. Then we can tell that if you have any concern, you can ask. Then maybe patient is asking you, so you mean that I have to continue with all your advices? Is there any need for doctor's consultation? Then we can tell that yes, your questions are reasonable. I can tell you that, Mr. Johnson, it is always suggestive for making a doctor's appointment, especially with your general practitioner, so that you can have the health checkup and your doctor can rule out any underlying problem or what is the exact root cause. Is there any root cause? He can reveal that. So always better to consult with your doctor as early as possible. So are you okay with that? Like that we can ask. Then patient's answer will be yes, of course I can make the appointment with my GP. Then you can conclude the sentence either with a GP's appointment because you are sitting in the health center only. We can tell like this, okay, Mr. Johnson, do you have any more concern? Then if it is no, you can tell that. I'm reassuring you that if you follow all my advices, your problem can be resolved within a limited extent. And if you're interested, may I proceed with your GP's consultation? Then if it is yes, means you can continue with that. So that is only the role play. I hope it is clear for you. So always if you are talking to a old age person, please take care. Be polite, and always when you are giving advice, take care. Don't use any demanding words. And at the end, just imagine what is the scenario, what will be the conclusion. Then you can conclude it. Okay, I hope it is beneficial for you. We will see with another informative video. And then bye. Take care.